But turning now to substance use, mental health, and how they're connected in New York. If you watch this show, you already know how urgent the state's mental health crisis really is. Even 2 years ago, more than 2.8 million adults in New York had a mental health condition. That's according to the National Alliance on Mental Illness. And in the 2 years since, we've seen signs that this crisis isn't getting any better. More than 3 in 10 New Yorkers reported poor mental health in March of this year. That's according to the New York Health Foundation. And that's about the same rate that we saw in 2021 as well. At the same time, we know that overdose deaths ticked up in New York last year. And both of those issues, mental health and addiction, are often interconnected. So 2 advocacy groups, one focused on mental health and one focused on addiction, have decided to team up and work on both issues together. The result is an entirely new group called the InUnity Alliance. And for more on that and the future of mental health and addiction in New York, we spoke with John Coppola, a co-director of InUnity Alliance. John, thank you so much for being here. I appreciate it.
Happy to be here.
Thank you. So my first question is, why team up?
Well, we had 2 organizations that both had a major focus on advocacy and trying to ensure that communities across New York State had addiction services or mental health services. And in the advocacy work, bigger is better. More voices is better than fewer voices, and parallel tracks. So we really felt it would be a really good idea to bring our advocacy efforts together and to pool resources and to be a stronger organization and better representatives of the people that we are advocating for.
You know, when we talk about mental health and substance use, these are 2 areas that often intersect. And I don't think that a lot of people understand that. Can you talk about that? You specialized in substance use before this group, so yes, you have a very firm understanding of this.
Yeah. I mean, for all of us experience difficulties in our lives. And many of us belong in families where somebody in our family tree had an issue with alcohol or drugs. So there's a biological dimension, a social and emotional dimension, and almost all of us at some point during our lifetime need some help and support from somebody. And increasingly, I think people are more comfortable with the thought of therapy and help. But it is a very common for people to have an issue with mental health or addiction. And probably none of our viewers today probably could say, I don't know anybody who hasn't had that. So again, unfortunately, we haven't had the infrastructure or the services or the support necessary for people to easily access those. If you have a young child, for instance, it's extraordinarily difficult to find a good therapist or a good program because there's such a lack of resources, which is really unacceptable.
And I think I would even say not even just for children. I think for regular U.S. adults, New York adults, it's tough to find a therapist for a lot of different reasons. I mean, it's tough to find them because they're out of your insurance network. It's tough to find them because you live in a rural area where a lot of people haven't settled, so there isn't access there. So I want to unpack kind of that big box for a second. What do you see as the most pressing needs in these issue areas?
Well, I think, we're starting to talk about it, resources, and that really starts first with workforce. Are there professionals in our communities that we can turn to? Are those professionals adequately supported? Are the services adequately supported? Are they accessible? Right. And the simple fact of the matter is we've done a poor job of doing that. So consequently, we have people, who are untreated, undiagnosed, and just have not been able to access the services they need. So I think fundamentally, it's how serious are we about addressing the needs that people have. And, for many years, cancer had a lot of stigma attached to it. And that's what we really have encountered a lot with addiction and mental health. And as we seek to reduce the stigma associated, and I think a lot of people are becoming much more public about their recovery, and that good things can happen for people who have an addiction issue or a mental health issue, that recovery is possible and that people can get better, but we've got to have the resources. And so workforce is a huge issue. Adequate resources is a second.
On the workforce issue, I spoke to the mental health commissioner in September about this. And she said to me that really the solution there should be to incentivize more people to enter these industries. And that could come in the form of scholarships for people or loan forgiveness. Personally, I don't see loan forgiveness as a great option just because if somebody doesn't have the money up front to go to school, loan forgiveness isn't going to help them. What do you think about that? How do we get more people in here to just do this work?
You know, I think there's a huge opportunity, actually. One of the things that's happening in a lot of services is the people who themselves have had an issue with addiction or with a mental health challenge, who would make fantastic peer helpers, peer professionals, people who could become social workers, psychiatrists, psychologists, et cetera. Nurses. So I think part of it is really, building that sense of, giving back, and also that there are opportunities. And if you think about people who are coming out of the criminal legal system, people who've paid their debt to society and who are now looking for an opportunity to give back, there are numerous success stories of people who learned from their mistakes and were able to help other people. So again, I think if we look at the composition of the communities that we live in, and do the people that we are employing look like the people that we're helping? And so looking at equity, looking at structural racism, looking at other things that kind of keep people from engaging. I think if we do a really good job of being a welcoming profession, that's our job, is to help to create a public awareness of the good that can be done in prevention and treatment and recovery and harm reduction services, and to try to really help to promote that work, and because it really helps to make for a better community.
And incarcerated people, that's an interesting point, because incarcerated people often when they come out talk about traumas that they experienced, either at the time of the crime and times of their lives, or either in the prison themselves. And I bet that would really lend a helpful device for them to use if they entered a mental health field. I want to switch gears, though, and talk about substance use for a moment. You know that overdose deaths in New York ticked up in 2022, an unfortunate thing that happened. The state is kind of entering this space that looks like harm reduction in some spaces, but at the same time, the state isn't really endorsing overdose prevention centers that have opened in New York City. So what do you see as the future of harm reduction in New York? Should it be that endorsement of those overdose prevention centers, or are there other strategies that we can pursue to get those numbers down?
I mean, I think it's very simple. Anything that we can do that's going to save somebody's life, we should do. There are people who use drugs, and people who have addiction. And if they're not ready yet to sort of let go of that, or if they have no intention of doing so, then to what extent can we help those people to be as healthy as possible, so that when they decide, if they decide they want to stop, they have the opportunity to do so, and they have the strength to do so. And then for others, I think just trying to reduce risk, and really thinking of harm reduction as part of the continuum of services. Prevention is a huge issue, and it's prevention at all ages. And then as the risk goes up, trying to reduce that risk as much as possible, and to help people be as healthy as they possibly can be. So I do think that it's going to be, I think harm reduction, treatment, prevention, recovery are all component parts of a comprehensive strategy that are really important.
The state has authorized the opening of what are called crisis stabilization centers in counties across the state, with the stipulation that they can open if they have the funding to open. Do you see that as the biggest barrier here in terms of addressing both mental health and substance use in terms of the resources? Does the state just need to put money into this to get better?
I think that's part of the answer, but I think the other thing is to re-examine, we have a lot of money that we're investing.
Yeah.
And are we investing it in the right places? We have a huge, huge system, but can we justify spending as much money on these huge buildings and grounds, et cetera, serving a relatively small number of people? and then there are underfunded services. If you think about recovery services, there's many counties in this state that don't have a recovery center.
Yeah.
There's many counties, many schools, many senior centers that don't have prevention services. So it's a combination of using our resources that we already have in the system effectively and efficiently, and then saying, where are the areas, and are we serious about this? That's the other thing. I mean, are we really serious about reversing? When we wanted to deal with COVID, we were serious.
We really dealt with COVID, yeah.
We were serious, and we had the statistics on the number of people who died yesterday, literally 24 hours. We're still adding the numbers up for 2022 and 2020, early 2023. I mean, so we're not even close to responding with that same level of urgency.
We've talked about government. Are insurance companies also part of the problem here, or are they part of the solution? When I see, I'll tell you my personal story just briefly, and I mentioned this on the show before, is when I was looking for my most recent therapist, it was so difficult because nobody was in network for my insurance company, and nobody who was in network was close to me, and I wasn't really comfortable with virtual therapy. I wanted to do something in person. Do insurance companies need to change here, or is it the government that needs to do something about it?
So start with your question about are they the part of the problem, part of the solution?
Yeah.
The answer is yes. They are part of the solution, and yes, they are part of the problem. And you I think, hit the bullseye. To the extent that there's a reasonable rate for services, right? What does it cost to have a therapist, a psychiatrist, a social worker, a peer provide the services that you need? What does it cost? Right. At a minimum, the insurance rates should cover the cost of providing the service. If every time somebody walks through the door, the program that you're going to or the therapist you're going to is going to lose money, at some point they say, I can't take those people anymore. I can't afford to treat somebody who has insurance that pays me less than what it costs me. And that decision is made. It is not unusual to find therapists that don't accept people who have commercial insurance. That's not okay, right? So again, I think we've got to really work to make sure that program, and again, this is InUnity Alliance is very, very strong on developing a positive relationship with health plans to help move in a good direction, but also confronting the issues. And so that's something that's right on our radar right now. And it's reasonable for any employer to expect that when they pay their premiums for mental health services, for addiction services, that their employees are going to be able to find a therapist and get the help that they need. That's reasonable.
Right. I mean, this is just such a big issue area. We could talk about this for hours. There are so many different parts to it, from insurance to care to what the state does, that there's a little bit too much to unpack, and we're out of time. John Coppola, co-director of InUnity Alliance, and you previously served as executive director of Alcoholism and Substance Use Providers of New York State. Thank you so much.
Very happy to be with you. Thank you.
Of course. And if you or someone you know is struggling with substance use or their mental health, we'll post some resources on our website. As always, that's at nynow.org.